Welcome to the Speechie Side Hustle podcast. Today we're talking about the science of collaboration, moving from independent practice to integrated care models. Today is going to be a pod course that is available for ASHA CEUs on our Tassel website. Our learning outcomes for today will be to define interprofessional collaboration and integrated care models as described in current healthcare research, identify structural, cultural, and professional factors that contribute to isolation, perfectionism, and siloed practice in speech-language pathology, describe how high-functioning collaborative teams support both improved client outcomes and sustainable aligned career pathways, and apply at least 3 evidence-based strategies to move from independent or isolated practice towards a more integrative, collaborative model of care. So today we are joined by Rachael Ioquinto, and thank you so much for coming on. Do you want to introduce yourself?
Sure. Thanks for having me. Happy to be here. My name is Rachael Ioquinto. I am a speech therapist. I own a speech pathology practice called Simpli Speech. We are out of Michigan, Southeast Michigan, and we have 2 locations in Whitmore Lake and Fenton. I'm also the co-founder of the Kids Therapy Co., and we are an interdisciplinary therapy collaborative with both speech and OT. And I am a clinical instructor at Calvin University for graduate students. It's very fun, very life-giving work. And I am a sibling of someone with autism and love to do things outside of work like play music and run music classes. So
Awesome. Thank you so much for joining us. I'm so excited to learn more about how your clinical experiences brought you here, just more about how you've lived with your sibling and how that's led you in a more neurodiversity affirming practice. So I'm very excited. I am Nicole Umana dos Santos. I'm the Chief Operating Officer and ASHA CEA of Tassel Learning and the co-host of the Speechie Side Hustle podcast. I have worked as an SLPA since 2017. I have a bachelor's degree from Emerson College, and I'm also the founder of Nicole Umana Creative, where I support small businesses with branding and design strategy. And I'm passionate about helping clinicians build aligned, sustainable careers through entrepreneurship and creative growth. So let's just do the financial disclosures. Rachael, if you'd like to do yours.
yes, I have ownership interest in Simpli Speech and the Kids Therapy Co. LLC.
Perfect. And I serve as the Chief Operating Officer for Tassel, and I do receive compensation for that role. And I am also the owner of Nicole Umana Creative. Okay, let's get started. So, what does research tell us about collaboration, and how is integrated care different from working independently?
Yes. So really, I guess independent collaboration is where we as therapists, we as providers, and also the families and our clients work together as a coordinated team to support our clients in a more of a holistic way. Really, I think it's huge to move from an isolated solo independent practice because I did that and saw how it was just one, it's isolating for us, but then it's also not as beneficial for our clients. And so when I moved from really just trying to bootleg it myself to collaborating with other providers, it really made a difference in my practice, the way that I served my clients, but also it made a difference in their progress. And there's so many ways to do it. It can be through shared planning, shared goal setting, or consistent collaborative communication. It doesn't have to even take too much time, but it's really, there's so much evidence and so much, I know I use this, but magic to collaborating together.
So, as a clinician, what was maybe one of the first things you did to acknowledge that you didn't want to do an independent practice anymore and move maybe to a more integrated care model?
For sure. I really struggled with feeling the gaps in treatment when I was just doing things on my own and coming up with everything for a client, thinking that I could provide holistic care for each client. But when I started reaching out and getting curious with other owners, with other providers, a lot of OTs. OTs have been incredible. And I think when I started getting curious, that led to more learning, which led to better outcomes for clients and led to just me feeling like I understood how to support myself better as a clinician, but then also how to support our clients better. And when I was doing things all by myself, I think I was on the road to burnout. And so it really just led to a lot of different things for me.
Yeah. Can you talk about any of the evidence that kind of links how that integrated care improves outcomes for both our clients and for clinicians?
Yeah, absolutely. So, really, for our clients, there's less gaps in treatment. Research really shows that when we work collaboratively, we can better address. I'm a speech therapist, so I'm going to speak to more of the communication needs. So, we can better address communication and participation in activities of daily life together. It's really beneficial because as we're just coming from different perspectives of care. So we can each bring our individualized scope to encourage functional communication, quality of life, participation in ADLs, which is really the goal for all of us at the end of the day, is to improve our clients' quality of life. So I guess I can go into an example about this, but we use integrated care in our clinic. I guess I'll give the example of AAC. We have quite a few clients who are non-speaking and also a lot of clients with various sensory needs. And so we collaborate with families, teachers, OTs, ABA providers, really anybody on the care team, and kind of work with them on how AAC is being functionally used. Because if I'm just using AAC in my 1 or 2 half-an-hour sessions a week, like, what are we actually doing for this child? Like, how can we functionally use this? And how can every team member functionally use this? And we can give bite-sized tips and tricks for them to use it functionally during every area of this client's life. So that's one example of that. But I think for us, it's just such a rich collaboration. Specifically, I'll speak to the OT side of things because we learn so much for each other. And we have very similar outlooks for speech and OT, not only on collaboration, but also like staying up to date on research and utilizing individual strength-based and patient-led care models. And it helps us to understand our clients' sensory needs, which are technically in the OT realm, but we collaborate with them to understand how to regulate each client and provide them sensory input they need. And on the other hand, they are able to learn more about AAC and communication, how to support that connection to collaborate across contexts for our clients.
Yeah. I mean, that sounds so important for the fact that you're supporting the client across different settings and that you're able to kind of work from it from different angles to get that like best outcome. Do you have any indicators for when the maybe for that the child's responding well to this sort of treatment?
Yeah, I think we do a lot of, obviously in speech and in OT and any bit of healthcare, you do a lot of goal setting and progress monitoring. And that piece That's what insurance sees. That's what shows growth. I feel like I have seen a huge uptick in clients meeting goals, and sometimes it takes time, and there's so much, you could go into this, but there's so much variation and progress isn't always linear, but we see a big uptick in progress overall generally and the research shows that as well, when we're collaborating and using integrated care models. I would say too, like, just in general, the connection piece and building rapport with clients. And if we're all using a very similar approach to how we're building rapport and trust and all of those pieces as well, it really allows clients to make more progress and also connect in huge ways. So,
Yeah, that's awesome. And I'm sure we'll get into that more. What about for clinicians? How would this affect them? I know we have here as a risk of that siloed care and how that can affect the clinician. Is that something you've seen that there's been research on?
yeah,
What are the risks?
for sure. I guess if we're going to talk about the risks, the research says that when you're using siloed care instead of integrated care, there's a lot of the times conflicting goals or strategies. So another therapist might encourage a certain skill, and then another therapist is discouraging that certain skill that maybe the SLP is building on to encourage communication. There can be inconsistent expectations for different clients, which would cause frustrations and delays in progress. There's gaps in care. Really, a huge difficulty with that is reduced carryover and generalization across environments. Family confusion and burnout is a huge one. If we're not collaborating and connecting as providers, it really puts that collaboration and connection on the family, or families get burnt out and then there's no collaboration and connection if we're not initiating that. And it just leads to a lot of confusion. So I really like to try and take that stress off of families because they're already dealing with so much, which is a whole nother thing that we can get into sometime. But yeah,
For sure. Well, yeah, if we feel like or if the research is saying that there is definitely better outcomes for both patients and clinicians, then that kind of begs the question, why do so many SLPs still feel like they have to do it alone or they have to work in this sort of siloed practice? Why do you think that so many SLPs fall into that?
I think this is really multifaceted. I guess I'll speak to the speech therapist sort of type A-ness, but I think that a lot of us think that we need to be perfect and we need to know it all. At least for me, coming out of grad school, that was a very hard pill to swallow. I'm like, oh, I just graduated. Now I have my C's. I have like all these things, right? All this credentialing. I've been to grad school. Our field is so wide. Our field is overwhelming, to be honest. I am learning something new every single day. And that's the beauty of our field as well, as we get to learn so much and stay curious. But I think a lot of SLPs in particular are very type A, or I guess people say type B SLPs, which is really like general public, you're type A. But I don't know. I think there's just a need to be perfect and a need to know it all. And so staying curious and having a collaborative spirit is so valuable, because I've met so many therapists that get stuck in their ways and stop that curiosity. They might stop asking questions or stop getting curious about things that would benefit their clients and would benefit their practice. So I think really we just need to give ourselves permission to put down our pride we're always learning, staying curious, and we can become better therapists and better supports for our clients and families if we have that outlook.
For sure. For sure. And I do think too, like one of the things we have here on the side is just the cultural norm in healthcare that, we can do things independently. We have that knowledge or even that tendency just to be perfectionists. Like any SLP who has their C's have done a lot of schooling, they've done a lot of research, they've gotten to where they are because it's a very rewarding track, but a very kind of narrow track, just very like rewards based, I guess, as we've all gone through school and whatever. That's how programs tend to reward you is on that. So it's kind of hard to set that aside. Now you're in the working force and trying to see how you can collaborate with others, rely on others, as well as just, I don't know, different people if you're working in the school or in a clinic, if there are certain like productivity pressures or if you need to meet a certain quota from how things are set up. You need to see so many patients this month, whatever that might be. There's probably a lot going into how SLPs feel like they do need to do so much and do it alone.
Yeah. I think that's too one of the reasons why I started Simpli is I worked in a hospital. I did a lot of outpatient. I worked in just so many different, I don't know, areas our field. And I had a hard time because I think relationship-based care is so valuable for both us as clinicians and for our clients. And I think those productivity pressures, all of that, the status pressure that you see in hospitals, I mean, that just wasn't for me. And I think I really wanted relationship-based care and collaboration in this way of, put down your pride, get curious. And we're staying in our realm of what I can practice in, but at the same time, I'm learning so much from other providers that I'm able to at least use that as a lens that I see through. So,
Yeah. And one of the articles you had submitted was the Bennett and Gadlin. Can you speak a little bit on the research from that article about psychological safety and team dynamics?
yes, yes. I think that just reading that article, I would probably recommend reading it. Living that, seeing it and living it, it's very interesting because trust is a huge piece of collaboration. And if we don't have that, the research says this, and obviously, like, we live this daily. So the trust is a huge piece. Like, having that, I have built quite a few relationships with different OTs and PTs that I trust and can go to if I have questions. But if I didn't have that, I think I wouldn't be able to, it would just be harder for me to bring that lens into my practice and also keep on the lookout for any red flags and anywhere that we can support our clients. But we value building trust and value in both your web of people. I don't know why I can't think of the word, but both professionally and personally is extremely valuable. I also think we all need to remember Bennett and Gladden really says that team dynamics are important for patient outcomes. And I know I just said trust already, but really having open communication, candid discussions, constructive disagreements rather than destructive conflict. That's a huge thing they talk about in there. My commentary on that is just that we all need to remember that we're all just doing our best. And when we know better, we do better. I always assume that people are doing their best. And just like we always assume competence for our clients. So really that trust piece is so valuable because people need to feel safe to speak up and also to admit uncertainties so that we can effectively collaborate. And some people just don't get along, and that's fine. There's different personalities, but I think that frequent communication, clear and open communication channels, and self-awareness are huge pieces. And that's what Bennett and Gadlin talk about in their research.
Awesome. So what are some different ways that maybe an SLP who's trying to move from this like do it alone mentality into a more integrated care practice? What are some ways that they can use those like strong communication skills that the article talked about, or the kind of conflict resolution, things like that, to expand their practice, help with their team dynamics, and kind of grow from there?
Yeah, for sure. So I think if you to really start, I don't know if you want to speak to just like a general SLP in general, but from my perspective as a private practice owner, I think it was valuable for me to really focus on the relationship and really focus on staying curious with both speech therapists and then also dietitians, occupational therapists, physical therapists. Just start making those relationships and start asking questions. It doesn't need to be anything like, not in a prying way or in a prove yourself way, but more in a relationship building. Like, I trust you. I trust that you've done the research. I trust that you are good at what you do and have a great perspective. And how can I use that? Getting curious about how can I use that to strengthen my perspective as this kind of therapist, and just building those relationships. I think building the relationships and starting with trust, even if it's just small little bits of connection, is probably the best way to start.
Awesome. Well, that's a great tip. Let's dive into this a little bit more and see, what does effective collaboration actually look like in practice? And maybe if you want to think about this in different settings, I know you're in a private practice, so if you kind of want to speak to what collaboration looks like there from your perspective, and maybe from whatever else like the research that you've read has said.
For sure. The first thing that comes to mind, to be honest, is when I was this is going way off of that, but when I was in grad school, I worked at a pretty well-renowned research hospital and rehab hospital. And we had, for our really complex cases, all of the care team would meet a certain time. I don't know if it was like once a week. I can't remember the exact timing on that. But that was like a very formal way to demonstrate that interprofessional collaboration. And it really helped us to make sure that we were seeing all perspectives for each client. But for us, I think we typically try to have little bits of communication. It's very hard in outpatient because there's so many barriers to this. We open the kids therapy code so that we can all be in one area, so that there would be a little bit more open communication. At Simpli Speech, we do a lot of push-in therapy to reduce that fragmentation. But constant communication. We are in constant communication with families. We try to, if we're seeing kids at a clinic or at a school or at their daycare, we're in communication with families, like what we did that day, how are things going at home, things like that. But in general, the standards, I know I got off of that, but we really try to keep those standards that the research talks about. So that mutual respect for one another. We're respecting that the family is the professional on their child. We might be the professionals on communication, but the family is the professional on that child. The OTs are the professionals on sensory processing and all regulation, all those things. So really respecting each other's perspective, but also bringing that into our own lens. The other things that the research talks about is really commitment to patient-centered care. Like, we're all here to help these clients or these patients, all here for quality of life improvement. Keeping that in mind when we're collaborating, because things can get dicey sometimes if we disagree. So really respecting each other and respecting that we're here and we're all doing our best for each patient. And then trust and integrity is the other thing that the research talks about, as well as relationship building and really respectful communication while we're respecting each other's scope as well.
Awesome. So would you say that, especially like in Simply Speech and what you're doing now, that you have that kind of still like a structured time for checking in with other providers, or is that something you do more informally or even with
Yeah,
families? Kind of how do you structure that within your practice to make sure that everyone's getting that equal time or attention that they need?
for sure. It is a challenge. I would say it depends. We do a lot of different things. So, for a lot of the locations that we push into, we go into a lot of different centers or preschools and daycares. And we have like a structured one-on-one with the other providers that work with the clients, probably like once a month, once every other week, something that's structured so that we can really go through like the clients that we're seeing with them. How are they doing? What do we need more of? Is there anything that we can do on our end to support them better? What can we help you do to support the client better? We do a lot of shared updates with families, whether if they're coming into if they're coming in to do outpatient services, then we see them and we're able to do either therapy with them in the room so they can see the strategies and things that we're doing and then bring that home. Or if they prefer to stay out of the room, and then we typically will have them come in for the last 5 minutes and go over updates and talk about what's happening at home, what are we doing here, how can we collaborate to really help with continuity of care. Some people do shared goal writing. We do that sometimes. It just depends on the providers that we're working with. We're obviously very open to that, but I don't like to assume, since we are like a separate company, I can't say like, oh, this is what we do and you're doing it too, you know?
Mhm.
So it is a challenge at times, but I would say weekly, daily check-ins or every session that we have with the child, we try to check in with at least the parent or another provider so that we're in constant communication, and it may just be bits and not like a complete meeting all of the time. But yeah, knowing that we have that trust that we can go to one another if there are any questions, and just keeping that trusted relationship fresh is really helpful.
Yeah, that's awesome. So you would say you do some things maybe a little more formally, but a lot of stuff is just informally as you're passing. And I liked how you talked about like incorporating the family, whether that was maybe through parent education or just that they're seeing what's going on in those sessions. Is there anything else that you do intentionally to incorporate the family's voice into maybe goals or just however the team is collaborating, make sure everyone's on board as well?
Absolutely. That's one of our first questions. So I do all of our intake calls for families because I just can't let it go. And I love just meeting with families and hearing their perspective. And that is like one of the first questions that I ask families is like, what are your goals for your child or whoever we're treating 30 days from now? What are your goals for them a year from now? What do you want the rest of life to look like? Just so that we can use that as our framework for understanding what context are we in, because a lot of our families come from different backgrounds than I've come from. So how can I understand what your home life looks like and what your family life looks like, and going out into the community, what kinds of functional things do we need to work on, and what will best support these clients and families in their real world, because to be honest, the speech room isn't the real world. So how are we supporting them in our context to be able to be functional and just have a better quality of life in their context? I also, if wanted to touch on this, if kids or if we're treating adults, we do see some adults. When we do that, if they're old enough or if they're adults, then we try to include them too on their treatment planning and collaborate with them, because it's their life. I would want to be included as well. So
Mm-hmm. Awesome. Thank you so much for those tips. So we've talked a lot about how this feels more doable when you're in maybe like your own practice or have other providers maybe within your area. Is there anything or any advice you would give to maybe a school SLP and they're the only SLP in their school or covering even like 2 or 3 buildings? And I don't even think we touched on this much before, but that's definitely probably something that's contributing to some school SLPs burnout, is that they don't really have the same availability that somebody does in a private practice to kind of bounce ideas off of their coworkers. Is there any advice you would give them on how they can take an integrated care model and try to incorporate some of that into their practice as well?
That's a good question. Yes, I would say typically there's so much to this, because the burnout for school SLPs is real. And if there are any school SLPs listening to this, I commend you. You're amazing. Keep doing what you're doing. I would say, again, like, just get curious with your coworkers. Things are just like going through my mind of situations of just everyone is running on a very thin line in the schools of burnout. So one, I hope that you take care of yourself, but two, like, I know that if you're the only school SLP in the building or 3 buildings, it feels like you're doing it alone. And I think having someone you can go to and trust. For me, like, my grad school best friend, Courtney, is my go-to. So if I am struggling or have a day or even just need emotional or mental support when I worked in the schools, that was my go-to of like, help. I don't know what to do here. So I know that's not necessarily interprofessional on a multi-specialty scale, but I think that is a huge piece of having somebody that you can go to that you trust. Again, fostering those relationships, keeping those relationships open when there is somebody that you trust, both for clinical decision making and also for just mental health in general. And then also just getting curious with the other providers. I know you're probably working with OTs, maybe not in every case, but there are some challenging cases in the schools, and there are also a lot of barriers to how we can help some of those kids and some of those students. So I think getting curious on how you can best support that child and also encourage what is the word? I guess encouraging the recommendations that you as maybe a special education team are giving, because sometimes in the general education classroom, it's hard for us to see each other's perspective. And anyway, we can go into that more, but I digress on that.
Awesome. Yeah. So, okay, so those are some really great tips. Thank you for that. And like you said, for all of our SLPs out there who maybe are feeling like just maybe less options to get out of like more of a siloed practice, that there are other people, whether it's interprofessional people within the school, OTs, or if there's a school psychologist or some other special ed team that they can work with, and how maybe they can, there's way that they can also have some of these like shared updates or other kind of structured systems for that as well, depending on how it is. Yeah.
Yeah. I also think too, like, use your resources. Like, you may not have access or like face to face with people all the time that you collaborate with, but to be honest, I'm on like 80 different Facebook groups of like, so that I can read and understand. And obviously, not everything on the internet is, you got to do your research backing it, but at least connecting. Like, it's easy for me to connect with OTs and other professionals through that because we're also interconnected. So it's a beautiful thing at times, and a not so beautiful thing at others. But it is nice that we are able to connect via technology.
Very true. Let's shift gears a little bit where I really would love to talk more about how you've used collaboration to position your clinic in the community and how maybe other clinics can think of this as like almost like a great marketing tool. So, how can collaboration strengthen your marketing and as the main goal really improve patient outcomes?
Mm-hmm. Yeah. So using collaboration as a marketing strategy, I think, is the reason why our practice grew so quickly. My goal was to have 20 clients by the end of the year, like a year from opening our practice. I just looked this morning. I'm still just processing it, but we're not even 2 years in, and we have almost nine we have not starting at another one. So 9 therapists and over 160 clients. And I
Wow.
think curiosity had blend to this, because if I was just sitting in my office waiting for clients to come, I don't think I don't know what would be happening right now. But I think I'm just in general a curious person, but I asked other practices and healthcare providers and everyone really in our community, what do you specialize in? What are your values? And then subsequently sharing our values after getting curious with them has led to different partnerships. That's what led to the Kids Therapy Co. Different collaborations. We go into over 12 locations across Southeast Michigan to provide services, and that collaboration is so much better than just having outpatient services and hoping for people to come to us, and also leads to us being face to face with other providers to collaborate day to day. So that's been really great. And honestly, like, it's led to referrals for both parties. Like, I am constantly referring people because when you find good providers and you find people you trust, you want to support your families the best you can. And we can't do that alone. A lot of these families and a lot of these clients need other help and other support more than what we can just do.
So, who were you collaborating with? What kind of businesses are you referring out to?
Yeah. We work with my office in Fenton is in a chiropractic office. So that's been fun because we don't do a ton of collaboration with chiropractic, but we get to refer back and forth, which has been really nice. Occupational therapy is the biggest thing. We work with a company called Motivate Children's Therapy. Shout out to Mallory and Savannah. They are incredible, and they just have that personalized, I don't know how to explain it. Like, we're just on the same wavelength in research-based personalized care, really integrating and collaborating on how can I support sensory needs for regulation so that this child can demonstrate joint attention to work on language skills. And they're very big on how can we support AAC and other all sorts of different communication strategies. But so chiropractic, OT, we do collaborate with some ABA providers who are very neurodiversity affirming, very assent based. So I have a couple friends who do really beautiful job with child-led therapy practices. And yeah, it's been really great to see the shift in that realm a little bit. So we do a lot of community collaboration with them. We collaborate with nutritionists, and who else do we collaborate with? A lot of teachers. Obviously, we do a lot of teacher collaboration, families. I would say that's the bulk of what we do. Yeah.
I really like this idea of like using collaboration that's quote unquote like a marketing strategy rooted in trust and not competition. That you're all here,
Yeah.
you all are here with the same goal. You want to help families. You're all coming with different points of view and different specialties, and it improves business relationships, it improves how you're presenting to the community as this resource instead of just, I'm just a clinic, this is what I do, this is my specialty, nothing else. But I think it's such a great way to really get yourself out there as an authority in the community to like, this is our specialty, this is how we can help you. And that you have this like spider web of other people who can support families.
Mhm.
I just feel like it's such
Yeah.
a yeah, it's such a great way, and like you said, it's you've gotten so many referrals just from starting this. How would you say you would look to kind of for somebody new, how would you tell them to kinda look for those providers in their area, or how would you tell them to maybe start with those relationships, or how can someone kinda network to get themselves there?
For sure. I guess I didn't even mention like psychologists. We do a lot of autism support. So I think honestly, I am a big believer in just putting yourself out there. To me, the most intimidating providers to collaborate with have been doctors, just because I'm like, oh, I know all these big providers for speech are reaching out to them and already have a relationship. And I think like most of the time, I'm just getting in my head with that. And people are open to learning about your services because we are in such need of support for these families need support. These providers need people to send their families to that they trust. And so I think honestly, just starting with either a phone call, to be honest, it's weird, but I have been doing a lot of DMing on Instagram, and that has opened a lot of doors. We go into different places, and I'm trying to think, really, probably 50% of our collaborations in the community are because I just randomly sent a DM to somebody on Instagram. Like it doesn't have to be too high pressure calling. Like I would call a doctor's office, but for some of these providers, like other speech therapists or people who are myofunctional therapists that we refer to in our area, just look at who's in your area and keep your ears open for if there's anybody that people recommend, and just reach out. And it doesn't have to be you pitching like, oh, hi, I'm Rachel from Simpli Speech. We do this and this. Like, it's more about the relationship and fostering that in a really safe way. So, like, hi, I'd love to hear about what you do in your practice to see if I can send people to you because I don't know. Yeah, just I know I've said curiosity a million times in this, but staying curious about other people, like people love to share about what they do, and I love to hear about it. So, yeah, I think just reaching out, it doesn't have to be anything that's a huge pressurized thing, like walking into a doctor's office without saying anything, but call, an email, a DM, it's opens the door.
I'm hearing that you're using a lot of kind of like basic sales 101 with the fact that it's good to hear from other people that some of that cold calling can work because
Mhm.
it does sound so intimidating to just cold call a practice, cold call chiropractor, doctor's office, whatever it
Yeah.
is. But what I liked about what you said about your approach is you want to find out about them and what they're offering, even maybe before you are presenting like what you can offer, because that kind of gets people to open up, lets their guard down, wants to have a conversation.
Yeah.
People love to talk about themselves or whatever maybe practice that they started and stuff like that. And that can make a cold call seem less intimidating when you're
Yeah.
trying to not just sell yourself, you're trying to create connections within your community. Like this is mutually
Mm,
beneficial. I want to know more about you. You want to know more about me. We're
yep.
here with the same goal to support people in our community.
Yes.
So,
Yeah, absolutely. And also just like keeping in mind that I think we so undervalue ourselves as therapists. And also, like, you can get in your head, like, compare yourself to the other practices, right? And we all start from somewhere, and you are valuable with what you do. Your perspective is valuable. And I think it's a little easier for me now because I'm not like necessarily selling myself. I'm like, there's all these amazing therapists that specialize in fluency and aphasia and apraxia. Like we have all of these specialists. And so now it's more like we are here. It's easier when it's not just yourself to be like, we are here to provide a valuable service to this community and the community needs it. So let's get the word out.
mhm.
It's easier to do that when you believe that you are providing a valuable service.
Mhm. I love that. I love the idea of like creating these intentional partnerships. And like you said, you work with other private practice, like SLP private practice owners as well.
Yes.
Yeah.
Yes.
And
I think too, like it's hard when there are other SLP private practice owners that aren't collaborative. But I will say that in my experience, that is few and far between. And if they're not open to that, then that's okay. And there will be other people that are open to collaboration. And we've created just a really nice group of therapists in Southeast Michigan that I can say, call up Sarah and say, hey, I have this client. He's in your area. Can you take him on? Or we don't have an opening at this point. Do you want to do virtual therapy with this client? So it's been really nice to work together. And also, like, we all have our own specialties. So there might be a better fit for a client in one person's team than another. So
yeah, absolutely. I mean, everybody knows our field is so big, and I've loved in other conversations I've had on the Speechie Side Hustle podcast that we really need to focus on not trying to compete with one another, but work with one another. There is enough work for everyone. This is a field
yeah,
that there is a place for everyone to find what makes them the happiest, or even just
yep,
understanding work-life balance, that you don't need to be the answer for every single thing, that we are all here to work together. And so I think if you're coming from a place of, I want to have this private practice or like this mobile clinic or whatever, everything that we have, our specialty, our schooling, our personality, our life experiences, that we might be the perfect fit for one family. We may not be the perfect fit for another. And that is completely okay. So,
absolutely. Yeah, that
yeah.
collaboration over competition every day, all day. And it's just so valuable. And I think it also just creates a belonging and community. Like I I don't know where I was reading this, but I just love the idea of like, if there's not a table for you to sit at, make your own and invite everyone to that table.
Mm.
And I think that is honestly what we've been able to do. And I encourage everyone to do that because it it creates a place of belonging, and also it's just magical. So
Yeah. And I think that kind of leads right into the next thing that we wanted to talk about with Collaboration supports sustainable, aligned career paths and businesses for SLPs. So, is there anything else you want to speak to about how collaboration really supports even just SLP businesses in general?
Yeah. I mean, I feel like we touched on a lot of it, but really from the business aspect, I think it's so easy to get burnt out as a business owner, thinking that you have to do everything alone. And I fall into this, still working against it constantly. And in general, it's easy to get burnt out as an SLP because we put so many hats on ourselves. And we're also expected to wear so many hats. And I think just, allowing, you don't have to do it all alone. Just that piece and allowing yourself to live into that is really helpful to prevent burnout. But as a business owner, time is hard to come by. So allowing time to collaborate, but then allowing yourselves to give different pieces of ownership of the business, different tasks of the business to people and collaborate in that way is very helpful because it is very easy to get to a burnout stage. And then you're not helping anybody because if you are not okay and you're not supporting yourself, both mentally, physically, all the things, then you're unable to help your clients. You're unable to help if you're not seeing clients, then you're unable to help your speech therapist and support them in the way that they need to be supported. So
Yeah.
just very helpful.
Yeah, I agree. And I think this also is something that can talk to any SLP at any point in their career or journey, whether they're somebody who is just doing like a on the side mobile practice, somebody who's starting like a brick and mortar, somebody who's trying to scale a full clinic. That
Yeah.
a lot of what you've talked about is maybe you're thinking about it on one hand as like a marketing system, a business strategy, but at the end of the day, no matter where you are, what level you're at in that process, you're creating that referral ecosystem.
Yeah.
You're creating a community. You're creating yourself as somebody that people are going to look to for more answers, whether that's like a mentor mentee relationship or just places that families feel safe to talk to. And I think another one of the articles that you had submitted, it was more geared towards children feeling safe in the therapy room, but it mentioned that when people feel safe, that same principle, when people feel safe, they're going to run through those goals. They're going to improve a lot
Yep.
faster. So yeah, thank you for
Yeah.
bringing that on.
Absolutely. I think too, it's so easy for us to just be in our own worlds because it takes more time and more energy to collaborate with other people. But we're honestly, like I always like to say, we're better together. We're we are by ourselves, we are one piece. Together, we're literally creating just beautiful things. So it's great. Relationships are lovely.
Excellent. So what practical steps, we've talked about some of them, but what other practical steps can you give clinicians to move from that independent practice towards this integrated care model? Can you go back to maybe really those like super simple first steps that you took or how you mapped out how your clinic would get started in this way?
Mm. To be honest, I just did it. But now looking back and looking at the research, I'm like, oh, this makes sense. So I think really setting yourself up to have time or having some sort of system in the way that you collaborate. So whether that be via email or having case conferences or having certain times that you share updates between providers, that could be coordinated treatment planning with other providers or with families or with clients. I know we talked about this, but we're just in constant communication by either calling, messaging, emailing, somehow having little tidbits of communication in there. We do a lot of, with AAC, a lot of sending different videos or different tips and tricks and just small bite-sized things, because I think people are busy. We can have these meetings, but like, what are we going to take away from this? What are we going to take away, and what perspective are we going to take to shift our perspective? So I think really just incorporating everyone's voice into the treatment planning, into treatment sessions, into functional homework or tips and tricks to use is the most helpful for most clients.
Awesome. And you mentioned something for new grads and how they can develop those relationships. Why do you think that's important to do, maybe like straight out of school?
Mm. Yeah, that's a great question. I think going back in, since I have the lens of teaching grad students, I think a lot of the times grad students are so in their own head of like, I need to prove myself, and so in their own world of learning only speech therapy things, right? That a lot of grad programs don't really touch on that interprofessional collaboration until you get out into your internships, and maybe you're not even seeing it then. But I think, again, it's a pride thing, putting down your pride and just saying, like, get curious, on try and understand other people's perspectives, because that is going to make you a better speech therapist. The most that I have learned, speech therapy in general, we do a lot of higher level, right, work. And there's a lot of things, a lot of regulation and different strategies and things that we need to do at the base to get to work on those skills. And we're not really the professionals on that. So how can we get curious to help support our clients? Because each client needs something different. And we may be this client's provider or the student's provider, but it's okay to ask for help. That's all I'll say.
Yeah, I love that. It's okay to ask for help. It's okay to learn from other people, no matter if you have 1 or 8 years of schooling
Yes.
behind
Yeah.
you.
We give and we take. We give and we
Yeah.
take all the time.
Mhm.
And that's a beautiful thing.
Yeah. So I love this idea of really, we don't have to redesign everything that we're doing, but what's just like one thing that we can take away, something collaborative, whether it's with our families or with other people that we're working with in our setting to implement. So for any listener out there, what's one thing that you took away from this that maybe you could implement in the next 30 days? So thank you so much, Rachael. This has been really great. We have some great resources to share here too. There are in the show notes, you'll be able to find links for 2 different research articles. And is there anything else from these research articles that you wanted to touch on share that we didn't get to?
I feel like we got to most everything. I would recommend just at least skimming them, especially the Bowman. I think that's a great just perspective for individuals with autism, because there's just so many complexities, and every child, every adult that we treat is different. And so just, it's a great perspective.
Mhm. Awesome. So that will be in the show notes for anyone who is interested in reading that. And where can people connect with you, Rachael? Where can they learn more about you, or if they have any questions, where should they reach out?
Yeah, oh, this is fun. We are, I would say, the most active on Instagram. It is Simpli Speech, at Simpli Speech, Simpli Speech, Speech. And then we're also on Facebook as the same Simpli Speech, and our new website is launching soon.
So
So
exciting.
unfortunately, I can't share because it's not up yet, but we're excited for that. So, but I would say Instagram is probably where we're most active.
Awesome. Well, thank you so much for coming on today, for sharing all of this knowledge. As I said before, this is a pod course that will be available for ASHA CEUs at tasseltogether.com. So you can find this there for zero point 0.1 ASHA CEUs. So thank you, everyone.
Thank you, Nicole.